So now to nursing, my real passion. I think it's fair to say that as a workforce of 660,000, a third of the workforce, and those that interact most with digital systems and do much of the data collection around patient care, we're critically positioned to drive the change in healthcare, ensuring that we use digital technologies to their best in order to support person-centred care. And if we move to the next slide. So we have the opportunity, but I guess as a profession, it's fair to say we are particularly challenged. I think it's interesting to note how much of our time is taken away from direct care that actually lends itself very well to digital transformation. So over 15% of time documenting, and yet we just keep doing it and doing it to our patients. So surely we can reduce that time. 20% of time on medicine admin, much of that is meds prep, it's not direct care with the patient, and 10% of time just looking for information in order to perform that unending task of joining up care with the patient at the centre of that. And so as you can see, it makes for a lot of non-direct care time. And yet we don't seem to have harnessed the potential that digital tech offers us. We haven't really had a particularly loud voice in this space. So we did a discovery across the whole profession, across all care settings, and this is some of the key things that we learned that were not particularly a surprise, but we really do have a lack of leadership voice. We really do have inconsistent levels of knowledge and skills that need to be tackled, variability in the digital and data literacy across the profession. We tend to end up, most of what went before is probably not unique to nursing, but what is particular to nursing, I think, is technologies that increase the burden. Because of the nature of nursing work and its sort of role as the glue in the system, we take on more and more technologies in order to do that joining up of care and meet the needs of other parts of the system, not necessarily the needs of us to deliver our care to our patients. And that means technology significantly increases the burden to the nursing profession. And there's a real limited visibility, I think, and understanding of the impact of nursing care, and there's a real opportunity through work like the interoperable nursing standard to address that. So on to the work of the nursing standard that we've been partnering with the PRSB for some time. We have done an initial discovery with PRSB, and the good news is there's a real appetite for this. There's a real appetite amongst nurses. You're going to hear from Emma, who was the patient voice in our early work, and was really central to emphasising what we should be focusing on. But essentially, in this nursing standard, what we're really talking about is being very patient-centric and making sure that the work of nursing is easily captured by nurses and then repurposed by many, many other professionals. And we have on the right some of the key things that we would like to do. One of the fundamentals for me, probably because I'm a nurse researcher as well as a clinician, is that national nursing data set. Without doing this, we can't really get to a rich national nursing data set that will enable us to advance practice, evidence practice, and importantly, in operational terms, evidence and seek resource for nursing where we need to, emphasising our cases for investment. So on the right are the key things that we now focus on as we move into phase 2. We've heard clearly from the profession, we've heard clearly from Emma as our patient voice that this is important work to do. We need to do this more widely, and it's really great that we do this with the PRSB because they're so skilled at bringing the breadth of clinical and patient voice together as we start to shape what a nursing standard might look like and where it fits within the wider standards that the PRSB have developed. Where is the gap? How do we do this differently? What does a nursing standard look like? Perhaps we might move away from the term nursing standard. It means a lot to us as nurses to be really clear what our practice is, but actually, in order to make it real for patients, this is about patient-centric care, and to our fellow colleagues, so doctors and AHPs, I think, who are less familiar with nursing theory, we may shift to a title that's about functional needs or a person-centred standard. so long as we make sure that it's easy for nurses to capture the right data, that they have a standard way of representing what they do, we will get to that point. And that's the deep and detailed work that we need to do with the PRSB in the coming weeks and months in order to develop that standard or that clear way of articulating nursing practice in the wider landscape.